came to Valdese Hospital 16 years ago, straight out of my training in radiation oncology, because I had been interviewed at around 4 different places for potential jobs, positions in radiation oncology, and I came here and immediately felt a warmth and a mutual support amongst the staff. I talked to patients that all felt that they were being treated kindly, gently, and lovingly. And that's hard to find. I think part of it is because this is a relatively small hospital. Even though we've expanded now, we remain a relatively small hospital. In fact, I would say that I am not aware of any cancer program, radiation oncology or medical oncology, in a hospital this size is well developed as Valdese Hospital. That's another reason that I came here. Valdese Hospital holds the distinction of having the longest continuously accredited community cancer program in the state of North Carolina. The accreditation is given by the American College of Surgeons, and this is pretty much an honor. It takes a lot of work to be accredited. Many hospitals seek accreditation. Not all can attain it, and sometimes they don't keep it once they get it. Valdese Hospital has had continuous accreditation since the 1970s. Now, a community cancer program is different than a comprehensive cancer program. The large hospitals that we might refer very unusual cases that are sometimes rare. Well, there are a few things that we don't take care of here, but the vast majority we can. Well over 95% of what develops in this community in terms of malignant disease we can take care of right here. Certainly, we see all the common malignancies, and so that's another reason the program is well developed. We have a very active program, a strong staff, and a lot of support from the administration. Over the years, we've had a lot of staff members come through this department. We've had a few that we really wanted to keep that moved on for other reasons. We've had a few that maybe needed to move on, and that was okay, but we certainly have the finest staff right now that I've ever worked with. We have a staff that everyone seems to have a personal belief system and approach to their work that promotes warmth and understanding, a loving attitude towards the patients. That's what I want them to have. That's what they have. These staff persons are involved with the patient through every bit of the process. Our goal is to explain what's going on, how we're doing what we're doing, why we're doing what we're doing, and I think that the patients really feel this. They have a sense of support and comfort. Overwhelmingly, that's what we're wanting them to have. We realize that when somebody comes to see us, it's not because they wanted to be here. It's because they're forced into a situation because of a disease process that they need to be a part of our care. We're on their team. We want to support them completely. And by and large, I think that the outcome is that people feel that way. I believe that when people feel loved, supported, and understand what's happening, I think the actual outcome from treatment is better. I certainly believe that their tolerance of treatment is better. Sometimes treatments, radiation or chemotherapy, can be fairly hard on a patient. But when somebody understands what to expect and why we're doing these things, they tolerate it better and they come through better, and the result is improved.